So, here we are, Monday the 9th, and 2 hours ago I got back from the doctor's office with my brand new Zolodex implant. I'm now on my hormone replacement therapy. Boom. Um, I'm happy as hell. I feel great. But maybe that's because my testosterone levels are going to start shooting through the roof because of the treatment. But they're going to die down like very fast, which is going to be amazing. And like I said in my last video, the Zolodex being accumulative and stuff, it's gonna be awesome. So, well, what basically happened was, I went in, uh, to my consultation last week where they gave me the prescription and stuff. I was like, boom, granted HRT, starting it on Monday. It was a great experience, being able to talk to them, and the endocrinologists, they were really helpful in all my questions and stuff because it was my secondary or tertiary consultation or some shit. So I had some questions that I forgot to ask the last two ones. One of the big questions was about the actual effectiveness and what is going to happen with me. And so they were saying, you're not going to notice stuff really early. You have to be patient. And I know that, I knew that, but I was kind of questioning, the effectiveness and will it agree with my body, and should it not agree with my body? What are the options? So like, obviously there's other treatment options and stuff, maybe a different drug or a different way of doing it or whatever. But so I agreed with the doctors then to do it on a 1 month basis. So this implant only lasts for 28 days, and then I go back in 28 days from now and I get my next one put in. After 28 days of being on this one, I assess how I'm feeling and how I'm doing, and if everything is okay body wise, if I'm not sick or if I'm not maybe having an allergic reaction straight away or any of that kind of crack, I go back to the pharmacy, pick up my next Zolodex implant, and I bring it to my GP again, and the nurse will put it in for me again. After that, I'll be going back for my blood tests in the hospital. It'll be a HbA1c, which is like a general blood test thing. They'll take a few vials and then they'll send it away. They'll be testing my hormone levels, my levels for the signals that are being sent from my pituitary and hypothalamus glands down to my testes to make testosterone. All those things are going to be looked at to see how testosterone production is going, and hopefully it'll be minimal. And should that be successful, which I'm pretty sure it is because I've been successful on everything so far. I mean, my liver is perfect, my kidneys are perfect, my cholesterol is like, I don't know, like 1 or 2% a bit higher than it should be, but like it's no big deal. My vitamin D levels were like totally low, so they had to give me a vitamin D injection, and that really sucked because that's a sub derma something injection. Like, it goes into your muscle, and it was deep, and it was apparently vitamin D is a really thick liquid, so like, oh, it was rough. But it was just in preparation because you need to make sure your body's good on all levels to start HRT. So once I'm done with the next 2 months, I'm going to be hopefully moving on to a 3-month implant, and then after that, having that for a while, it'll be a 6-month implant. And the same time around getting the 3-month implant, they'll be looking at giving me my estrogen pills. I don't know what the pills are yet. They haven't talked to me about that so far, but it's safe for a later date. Right now, I'm just really happy being on what I've wanted to be on for so long, which is this Zolodex implant. Like, and it's been so, like, crazy emotional. Like, I expected to like cry and everything today, and I really expected myself to kind of stop and say, maybe I don't want to do this or something. You know what I mean? That kind of thing where once you get to it, you pussy out or something. And when I got there and we were getting ready for it all, I didn't pussy out. I did ask myself, honestly, is this what I really want to do right now? Because I had every right to ask her to stop and not administer it, and I could have came back at a later date. after I had a bit more of a think about it and get it done again, or I could have just said no altogether and turned back. Because everybody has the right to do that when they start this process. You're able to stop whenever you want. If you feel like maybe you're going too far, maybe it's not something you really wanted, that's okay too. But I asked myself today, honestly, Lily, after so long of working towards this, you now have it. Is it really what you want? If everything that happened didn't happen and you had a choice to get this right now and you didn't have to work for it so much, would you still want it? Do you want it for the right reasons? All this kind of shit, you know what I mean, that I was saying to myself. And I was able to honestly say to myself today that I do want this. I want this here and now. I've wanted it for a long time and I'm going to get it. And after I got it, I didn't feel any kind of, oh shit, what have I done? I more felt I am a fucking king. And I say king, not queen, okay? I may identify as female, but I am a fucking king, just so everyone knows. So I feel ecstatic and I'm happy. So I was informed before that what this is going to do for me in the first, in the early stages of this taking effect is that my testosterone level is going to peak. And that peak is going to be, like a tsunami of testosterone. So it's going to be a raging hormone, but then it's going to drop, like, abysmally. It's going to drop. So I'm waiting for all that. I remember bringing up the question with them in my tertiary or secondary consultation or whatever about erectile function and sexual attraction and arousal, all that crack. And basically the functionality of reproduction, and they said it does vary person to person, but in a general sense your testes do get smaller. Your sperm production will be halted as your testosterone is halted. It does not make you infertile, but after receiving it for X amount of time, a couple of months or whatever, it will stop. You will lose the ability to produce sperm in your ejaculate, so you won't be able to reproduce as a male. So that's important for people to know. I think the range is usually, sometimes people experience it in the first 3 weeks of being on this. They stop. They stop producing. Some people it's 6 weeks. My doctor said in most of her experience it's been 6 weeks for most of her people who come in and get it. After 6 weeks, people lose reproductive capabilities. But that's with most of the people she's experienced. But sometimes she has experienced someone who'd be over a space of a couple of months, even, who are still able to reproduce in the first couple of months. So it's important to kind of keep track, I think, especially for me and for anyone else doing this. It's important to keep track on that every time you go for assessment, to be sure what you really want, because a lot of people do take the whole reproduction thing very seriously. I took it very seriously. I do want to have children, but I don't want to have children the way a man has children. So really, it doesn't really matter to me if I lose functionality. At the same time, it is important to me to actually perform sex. And that's another thing a lot of people are afraid of going through this, is that they will lose the ability to perform sex. And again, that is dependent on everybody. So I just have to wait and see. It is a concern for me because I'm a sexually active person. So gonna have to wait and see. One or two myths that are kind of out there is that apparently, people think everybody's penis gets smaller. No, not everybody's penis gets smaller. This is a message I got from somebody a while back. And if your penis gets smaller, it's not a big deal. It's really not, because the average penis size is, what is it, 5 to 7 inches anyway. So if you're losing a little bit of girth or length, don't be too scared about it, because it's not drastic. If it is drastic and you aren't happy with that, well, that is unfortunate, but it is a side effect, and everybody's bodies react differently. I'm not gonna be, telling you guys if my penis gets smaller or something, so please don't ask. Um, so yeah, functionality, reproduction, sperm production, hormone levels. They were all these things that were covered up until today, and last night was really stressful because I was like, today's one of these days that I thought was never going to happen. It's like every time I went to the hospital it was, well, another 3 weeks, or come back in a month, and did you get your psychoanalysis yet? Oh, and by the way, we need to get some blood tests first, and oh, do you identify as female every day? All this kind of crack, all this kind of stuff, these loops you have to jump through, like they're fire hoops. But now that it's all said and done, I was kind of like, wow, it's finally here, and that really got to me last night. I was kind of like, wow, and honestly, I cried. Okay, it's a really stressful time for anybody who goes through this kind of thing. Um, I'm really happy with people sending me questions and stuff after watching my videos, and I'm happy that a lot of people have liked to comment on them saying they like them, and I mean I'm happy that people have viewed them and hopefully have gotten a bit better knowledge about it from first-hand accounts, because I mean in Ireland there's so little information on being transgender and going through the male to female hormone replacement therapy process. So yeah, I mean, this is where I am now. I'm happy out. um I have my implant in my tummy. It was put in on the right side of my belly button. It could be done left or right side of my belly button. So um, there's no aftercare needed. You just have a plaster on it, and you take the plaster off. A couple hours later, you're totally healed up. It goes just under your skin. It doesn't go into your muscle or anything, so it's not that painful. It's just a little bit of a pressure, and it's not even that big either. This thing is tiny, so and in fairness, the needle looks a bit big and scary and stuff, but it's not. It's actually a little bit of a pressure, a click, and the click noise is a bit scary when you hear it because it's in your skin when it clicks. But then when it comes back out, you don't even feel it coming back out. The you don't feel the syringe coming back out, and then it's done. Um, I was so happy I was able to be honest with myself about it and saying that this is what I really wanted, because this is such a monumental decision for so many people to make, and I was able to make it today. I was able to make it honestly. I was able to make it on the basis of everything I've experienced and everything I have thought about for this long, that this is the right direction for me, and I'm really happy. I'm really happy. So hopefully, you guys will be able to start seeing some developments soon. I'm gonna be doing the whole photo a day thing. It's a good thing to do, because when you start to look back then through all these photos, you will see your developments and how things change, because you can't see things as they're changing because it's very slow. So I'll be doing one of those, so you'll get to see one of those, I guess, because why not? It's all part of my diary anyway. Um, and I'll be making more videos as things develop and as I go back um, for more reviews and all that kind of stuff when I move on to next steps and everything. Um, until then, I guess the HRT videos are gonna be nada, because well, it's done now. But there will be HRT updates coming up, especially since I like to keep track of it as well, and this is a good way for me to keep track. Um, Otherwise, I kind of want to be able to talk as well about other things, like gender identity is a big thing that a lot of people have questions about, because it can be such a fluid thing. I also want to talk about the gender spectrum in some of my videos. So if you're interested in seeing those, do stick around, and hopefully you enjoy um, my experience so far, and you got something out of watching this. So shut up. Okay. Anyway, um, thanks for watching. I guess if anybody watches it, thanks to everybody who watched the last video. I have a few shout outs that I was meant to do, but this video is kind of getting a bit long. I'll do them in my next video. So yeah, I'm really happy. Ding. HRT bitches all the way. See you next time.